I expect professionalism. I expect the medical staff, the doctors, the nurses to know what they are doing and able to provide advice and diagnosis, and not just the right diagnosis but the right treatment.
We all will probably go through a certain cycle in life where we would be unwell in later or maybe even at a certain age. We would like to be treated well. Now, this is something which it's not expectation, but more like, how would you like to be treated when you're not well?
The doctor who was giving me all the examination, the radiographer, see, she was very, very sympathetic in that sense, you know. And she told me, you don't have to worry, I shall recommend you a very good surgeon. And she is also a very pleasant lady. So I said, all right, you do what you can, and you know, this is new to me actually. This is new to me, and I'm very scared.
Just 3 of the many expectations, hopes and fears heard every day within any healthcare institution. As Singapore's largest healthcare provider, SingHealth is a regional and global healthcare leader. Singaporeans recognize us as the answer to their healthcare needs. How do we provide excellent healthcare, manage patient expectations, provide timely information, and at the same time offer comfort and assistance? To help you, we have 5 guiding standards that are the foundation of all we do within our SingHealth community, and we call them the 5 C's. They are standards we can benchmark, teach, and use to align our performance. The 5 C's also provide an institutional culture that nurtures strength of character for the difficulties we encounter every day. This is no more evident than when it involves the birth of a baby who is born early or with complications.
Having a baby, delivered a baby, is supposed to be a joyous moment, okay? But having a child to be admitted in special care or neonatal ICU is just like a shattered dream for parents, you know what I mean? That's where we, as a healthcare provider, we need to understand why parents are angry, why parents are sad. And knowing the underlying cause of this, it helps us in understanding what parents need. That is comfort, being compassionate, understanding what they have gone through.
No matter if you are a special care nursery nurse or the Group Chief Executive Officer, compassion is the ability to care.
I think we all know that treating a patient, it is irrespective of whether it is a minor condition or a serious catastrophic illness. The amount of psychological, emotional, and mental upheavals and disturbances that goes through the mind is something that we as doctors must understand and must take into consideration when dealing with the patient. And this is what compassion is all about. Compassion meaning the ability to care, your ability to understand, and the ability to share the same feelings with the patient and their loved ones.
Compassion, the ability to care, but we also need to communicate the comfort we bring to the patient. Communication, providing knowledge with understanding.
Communication is quite important because it makes a difference to whether the medication works at the end of the day. If you do not communicate how the medication is going to work, what is the likely side effects you're going to meet, the patient's going to come up with this expectation that this is not a miracle drug, you're bluffing me. We have this commitment that we want to make a change to their health, make a difference, and make them a happy person at the end of the day.
I guess communication with patients, we actually need to think a little bit more in terms of what we say to them and in making ourselves, allowing them to understand us a little bit better. Quite often, patients express their concerns and their questions that they have to us. So we need to listen a little bit more patiently in order to address all these issues that they have and ensure that they are reassured that they are in good hands. We need to be committed in whatever we say to patients and to our colleagues. I have to be committed in my work and committed to my patients to make sure that I deliver that so that their continued trust in us is not misplaced.